Hi, everyone. Good morning. Thank you for joining us for this live talk today. My name is Katrina, and I'm a staff scientist at Science North, and I will be your moderator for today. So this talk that we're hosting is part of our Virus of Misinformation project that we are doing at Science North. This has been supported by the Government of Canada. So if you have seen other events or talks around this, this is part of that project. So today, our talk is called, Why Do the COVID-19 Guidelines Keep Changing? So I'm sure that you have all noticed some significant change from last March and also through the last few months. We've been experiencing some changes in terms of what's happening in our province, our country, also around the world. And of course, this is impacting a lot of things when it comes to the guidelines that we are following, vaccine development, the scientific process and how we're learning about this virus. And of course, the more we know, the better it is. And so we are moving forward with, vaccine production and all of the science surrounding this virus and of course, learning more. A few things have happened lately with our stay-at-home order, our state of emergency order, and these are all things that we want to talk about and we want to be able to address. So this morning, we are very, very thankful to have Dr. Penny Sutcliffe, our Medical Officer of Health from Public Health Sudbury Districts, join us. We're absolutely thrilled. Welcome, Dr. Sutcliffe. It's great to have you here. Thank you for taking the time to be here.
Thank you for having me.
So I want to tell our audience, if you have any questions, please put them in the comments. We will be able to get to them and ask them as we go. So as we're waiting for you to enter all of your comments and your questions, Dr. Sutcliffe, I have one for you, of course, on the state of emergency and our stay-at-home order. So I'm sure everyone is wondering, what exactly does this mean? Of course, we've all been home, locked up in our home offices like this. Is there a difference between the stay-at-home order and the lockdown as well? Like, what are some of these terms that we need to be familiar with?
Yeah, it's a really good point. And the stay-at-home order was an order that was issued by the provincial government under the most recent and second declaration of state of emergency here. So the stay-at-home order is exactly that, for all Ontarians to stay home unless really essential that you're not at home. And so this now is an order, and it's intended to be, I think, as simple as possible, notwithstanding, I think, some of the confusion about it, that really you should stay at home unless there are essential reasons like groceries or pharmacy or healthcare or essential work that can't be done at home. That means that you should leave. And so different from the lockdown, because the lockdown is one of the areas of the coded phases for management of COVID in our province. And so those that were in the gray or lockdown parts of our province meant that they had high rates of COVID-19, and there were specific requirements there, but not an overall stay-at-home order as we have now, really to protect our health and our healthcare system as we've seen rates of disease really increase across the province.
Okay, so that's a really good point. So there is actually a difference. So we do have one question, and I think this is something that there's been some confusion on, I believe. So we're talking about significant changes in mental health, of course, as we're all at home and feeling very isolated. What are the guidelines about going outside? Can we go to parks? Can we go skating? What are the rules around that?
Yeah, it's a really good question and a really good point about the mental health impacts of the COVID safety measures. So feeling isolated, not being able to engage with our friends or our families as we would normally has a huge impact on our mental health. We've seen increasing rates of, tragically, of addictions and risks associated with overdoses, et cetera. This stay-at-home order does include the ability to go outside for exercise, for example, the ability to stay with members certainly in your own household, not to have more than 5 people gathering when you are outdoors, and no gatherings indoors. But really recognizing, so from a public health perspective, very pleased, recognizing the importance of exercise, of being able to be outdoors. So this is critical. So yes, there are places that are still open, no doubt about that, so that we can continue to benefit from that. And I think really, Katrina, it's trying to strike a balance between protecting ourselves from COVID and not having more harms from those protections that might occur, right, from the isolation, et cetera. So recognizing the importance of that for our physical and for our mental health.
Okay, so if somebody is feeling unsafe when they are outside, are there any recommendations that you have? Like, should people still wear a mask then? You know, what are other precautions that citizens can take to make sure that they're still being safe if they're going out to a park and there are other people?
Absolutely. So highly recommended to wear a mask outdoors if you can't keep 2 meters or 6 feet distance from each other. So extremely important indoors when you are, if you have to be at work or you're at the grocery store, must be wearing a mask or face covering. And outdoors, new recommendations about mask wearing if you cannot maintain those 2 meters. And so we understand that the risk of spreading the virus outdoors is lower. There's the fresh air, the ventilation, et cetera, not in an enclosed space, but still important to make sure if you are close to others that you wear a face mask. And again, gatherings outdoors, 5 people maximum is the current legislation.
Okay, so we had this is kind of leads me into this whole colored framework idea, and you had mentioned a little bit about this. How do we know when to put regions into the different colors? So what tells us when someone should be in green versus when we should be in lockdown or moving between those stages? What kind of criteria do you use or does the province use to determine what that is and how that looks?
Right, so it's a provincial framework with the various color codes, as you've noted, from green, yellow, orange, red, and then gray in lockdown. And this is really to help us, simplify and communicate about the different levels of risk. So trying to understand the risk of COVID and COVID infections in our respective areas. So that's indicated by the numbers of cases that we have, the rates of those cases. But really importantly, and this is not an exact science because there's some fingertips involved with this also. So really understanding it's not just the cases, but if there's a high number of cases, but they're all associated with one event, then that really, even though there's lots of cases, it's not an indicator of broad community transmission. So it's understanding the rates of cases, how those cases have evolved in our respective communities, our respective areas, what the impact is on the healthcare system. And one thing that, because I'm in public health, I find that we tend to ignore a little bit is the impact on the public health system. So absolutely we care about what's happening in our acute care system, and we very much need to care about what's happening in the public health system and the ability of our public health nurses and our public health inspectors to prevent disease. So to identify quickly new cases, to identify the contacts of those cases so that we can prevent further spread. And if we're not doing that work, then we are absolutely at risk of high spread of disease and high consequences in health and our healthcare system. So the color coding takes all of that into account, the numbers of cases, the characteristics of those cases or outbreaks, the impact on public health, and the impact on the healthcare system capacity, and sort of bundles all of that up and determines kind of which color code you should be in, and all of that information is available. There's been some discussion about what level should put you into what colors, certainly, and among my colleagues and at the provincial level. But that's the understanding right now. And so with that, depending on the color code we're in, that then determines the kinds of restrictions or protections that we have in each of those colored zones.
Okay. That is good to know. I didn't know all of that, so thank you. I appreciate that. Okay, so I just want to mention that if people are just joining us, we are with Dr. Sutcliffe from Public Health Sudbury Districts. Please leave your questions and your comments in the comments wherever you are. We will do our best to answer as many as we can in the time that we have. So I am going to just shift over to the comments for a moment because we've got some questions here. So, okay. We do have a question going back to the outdoors. Is there a point in time where we would need to shut down parks or skating rinks or anything like that?
I think that's a really good question. And some of this does relate not just to the amount of transmission and virus that we're seeing circulating, but also the kind of virus. So people will be aware that there are these variants of concern or different variants, a UK variant, South African variant, Brazil variant, that we understand are more transmissible. So of course, a big concern is as those get more commonplace and spread in our communities, what additional public health measures or more stringent public health measures might be needed to prevent transmission. If something is so transmissible that it might require further restrictions outdoors, then those decisions based on science will have to be made. But really, I think that the kind of virus that we're seeing and the transmissibility is a big factor in that. If we're finding that being outdoors, people are still gathering together closely, then there might be additional measures. And we know that's been the case in some parts of the province put in place to even stop that at this point in time.
Mm-hmm. Yes, I'm familiar with what happened in North Bay. So yes. Okay, so that is possible if we do get to that point. That is a thing that might need to be addressed. Okay, there is actually another question right here about the variant. Do we know if the new variant is here? And is this why we're seeing some of this uptick in cases that's happening right now?
Well, what I can say is we understand that the laboratory, the Public Health Laboratory of Public Health Ontario, is doing more surveillance testing to understand, to screen, to see if we do have these variants. And we do know, tragically, that the variant was the cause of a really serious outbreak to the south of us in a long-term care home in Barrie, Ontario, and spread really quickly in that home and tragically caused a lot of deaths. We've also seen that is at this point not just contained to long-term care homes, and there's concern about transmission in the community. So I don't think it's a question of if, but really a question of when. And so the stronger skills that we can build right now about the public health measures, building those into our lives, including if you have symptoms, stay home, get tested, as well as the measures about masking and certainly the stay-at-home order right now, very important so that we are as prepared as we can be so we can contain this as it does arrive in our communities.
Okay. That's good to know. Okay, we've got another question here. So I can't see this image, but we've had an image shared. I am going to guess that this is a misinformation piece because the question asks, how can we kindly respond with facts when we see images like this posted on friends' timelines? So how can we, and speaking again as a scientist too, I see misinformation all the time, and it's of course something we're dealing with our project. How can we nicely address when friends or family don't believe what we feel is backed in science, or things that we believe even, depending on what that is? What do we say? How do we do that?
Well, I think that is a very difficult question to answer. And I would start by saying it's really important not to attack the person. I think that we can often end up making these things quite, personal or personalized. And really, even you said about a belief, et cetera. this is not a belief. The facts about the virus and about COVID are facts. And what we do with them perhaps is, what is most important. So I think really going to credible sources, to acknowledging that there is a lot of, misinformation, but also a lot of fear out there that might be driving some of our attention on what we pay attention to and what we don't pay attention to. So going back to credible sources for sure at Public Health Sudbury Districts website and many others, federal and provincial, really valid sources of information, going to that, but not making it so much of a debate. I think perhaps showing curiosity, trying to explore why people are thinking a certain way, going back to points of fact that we're aware of, and acknowledging what might be underlying fear or concern is incredibly important in communicating effectively.
Yeah, I agree with that. I really don't think arguing wins ever. And I think we need to remember that everybody is human, and this might even go into some of the other conversations that we've had, even at Science North, and I'm sure as well at the health unit. There's a place for humanity right now. And I know that we were mentioning, there's a lot of stigma happening in the community as well. And it's just not the right way to be addressing what is happening. So, based in that, do you have any other comments about how people can interact with others, even online, or within their own circles, just to kind of address those types of things that are currently happening with, of course, all of the outbreaks that we're experiencing at the moment, and the fear of, sending your kids to school or even just going to your local park?
Yeah, absolutely. And I'm certainly am aware of a number of instances where there has been stigma or finger pointing or blame. And that comes from a place of fear. I understand that, but there is no place for that here. And the more that I think we're tired of hearing we're all in it together, but we are still all in it together. And that means Team Sudbury or Team Northern Ontario or Team Ontario or Team World. We are all in this together and need to support each other. So just as I've seen examples of stigma and blaming, which are completely not on, there's no place for that. Absolutely. I have also seen really heartwarming examples of people gathering together and helping each other. And I must say, the hours that we've been working in public health, that really makes a huge difference as we see that we are all coming together as a community to help one another, be that individuals who through no fault of their own became infected, perhaps then there was spread within their community or within their household. Not their fault. This happens and they need our support. So could not agree more with you about that.
Well, it's very nice to know that there are people who are supporting the community. That's lovely. I think we try our best, but when everyone feels, again, so taxed with all of the things that are happening, sometimes it's really difficult to take that step back and sort of think about what is happening. So these reminders are really important for us to be able to refocus and remind ourselves that it's really important to remember that everybody is experiencing this. Even if it's in a different way, it's the same thing. We are still all experiencing this, and it's important to remember that and to focus on helping people and being understanding. So I agree. I definitely agree with that. Okay, we do have a lot of questions coming in. So we have a lot of questions about schools, which does not surprise me at all, given everything we've been experiencing. So I will do my best to kind of go through some of these questions. Okay, I'll start with this one. With the upcoming plan for March break, the question is just, does the health unit have a plan, and is there a plan? Are we gonna see what happens? Do we even know what the plan is yet? Yeah.
So I would say that March seems like a lifetime away right now. Even 1 week to the next, we've seen how quickly things can change. I do not expect, I would love to be able to say, we'll have everybody vaccinated by then. There'll be no problem. Do what you want. We will not have enough vaccine in this country, in this province, in this area, certainly to have any expectation of widespread immunity by that point in time. So the public health measures will still be in place. And so even if we are in yellow, or would be fabulous if we could go back to green, there will still be requirements and recommendations about distancing, about masking, about limiting your travel, all of those kinds of things. So there should not be any plans about trips on March break. Certainly staying within our own areas is what I would foresee at the very minimum for that point in time. We also know that there have been waves of COVID, that number in the 3s and 4s. So we're in our second wave right now, prolonged second wave right now. And so I don't think that we can expect to be out of the woods by that point in time.
That was my thought too, which makes sense. I know it's okay. I think it just confirms everything that we were all thinking. Okay, so the next question is more related to the role that Public Health Sudbury Districts has in developing the guidelines within schools. So how are these guidelines kind of created? Does the school board have more a say in kind of what is happening within the school? Is it a collaborative effort? Does it come directly from the province and the minister? How does that work?
Right, really good question. And so this is directed by the Ministry of Health and the Ministry of Education. So in combination about the COVID guidance and guidelines and requirements for schools. So there are outbreak guidelines for public health, that guidance that we must follow, as well as direction to the schools and the school boards and what they must do. So the definition of an outbreak, how to understand if there's transmission in a school, all of that is, and then the requirements about dismissal of classes or cohorts or buses, or in fact, sometimes the whole school, those are in accordance with provincial guidelines. We have to, of course, understand what that means at the ground level. So as we apply those guidelines to our local circumstances. And so we do know in some instances, for example, schools have decided that for administrative or logistical reasons, they would want to pivot to online learning, even though there is no school-wide outbreak, that they just are assessing that it's better for their school community to go to the online learning for circumstances that are unique to their school. So that's applying the provincial guidelines to the local circumstances. And I get it, it's difficult. Parents are worried about their kids, teachers are worried for themselves and their own families. I absolutely understand that. I think it's important that everybody knows that we certainly still have the public health capacity to very carefully follow up on every case and their contacts, and then on the dismissed students, so that we are following very closely any potential chains of transmission and looking out for our kids and for our families. But those are by and large provincial guidelines that we need to follow.
Right. Okay, so that might help answer this other question that we have as well. With determining kind of how, I want to make sure I ask this question right from the comment that we got. Determining how far apart students need to be when they're in the school. So it's not necessarily the same as in a gym, for example, where people need to be 3 meters apart rather than 2, or whatever the case. So how is it determined when they need to wear their masks, how far apart they're sitting? Is this all based in those provincial guidelines as well?
Yes, it is all based on those provincial guidelines. And of course, we're aware there's been much discussion about the whole distance and the class size issue. I'm well aware of that. The Hospital for Sick Kids recently came out with a report about safe return to school, and talked about a bundle of measures. So distance is one, mask is another, surveillance and screening and testing, staying home if you're ill is another, like cleaning, all of these factors together, ventilation are all the protective factors. And I am of the mind that we are so fortunate in Northern Ontario that we have been able to keep in-person learning. I feel very strongly, and it's not just a belief, but based on science and facts also, about the impact on mental health and social and emotional learning of our kids being able to be at school, as well as for parents being able to get a break in terms of having to be teacher and mom and worker and everything else. So I think that I really strongly believe that we need to do everything that is in our control to maintain schools open for kids, safe for teachers, absolutely, but open for kids so that they can continue with lives as normally as they possibly can. This is a right and something that we've been able to protect for the longest time in the North, and I really want to see us continue to be able to do that, Katrina.
Yeah, I really feel that with my gym being closed. I know it's not school, but my gym is closed and I'm really feeling it. Online workouts are just not the same. So I can only imagine, we kind of forget that kids are also people, and they want to be with their friends, and they want to be in school, and they want to be normal just as everybody else. So I definitely, and parents I'm sure need a break. I know some of my friends have little ones, and it's tough. It's a hard balance. And, of course, again, we're all experiencing this. And so, parents are tired, and I'm sure teachers are also tired, and we're all exhausted with what's happening. And I'm sure the same goes for all of these children, whether they're at home or in school. Again, we're all experiencing this, and we need to remember that. Okay. Oh, we have a lot of questions. I am trying to filter through these. Okay, let's see. Where are we here? Okay, well, I know there are a couple of questions in here, so I will go to one of my questions because I think it will lead into some of these fairly well. So you had mentioned vaccines, and I know we've got a question that came up. When are we going to get back to normal? How long is it going to be until we can get back to normal? So Public Health has their vaccine playbook. I'm sure you're familiar with this. So we've heard a little bit about it. There's been a little bit of talk about vaccines coming in, not coming in, which one people are going to get. There's lots of conversation about what's happening in other areas, of course, in the country as well as in the world right now with vaccines. What exactly does the timeline look like for us? Do you have any idea? I mean, I know you might not know the answer to that, but is there a thought about when we might get them? And if we do have them, what will guidelines look like maybe this summer or in the fall as people start getting vaccinated?
Well, I was okay until you said what exactly would the timelines look like. I can tell you generally what the timelines will look like. So we have developed a Public Health Sudbury Districts vaccination program playbook. It's on our website. I invite everybody to check that out, which will give the overall timelines for what we're planning. So we are planning in a bit of a dark hole in terms of knowing the details upon which we can plan. But we know vaccine is coming. We know what the priority groups are, and we know generally what the sequencing is based on what the provincial plan is. So we've mapped our plan according to that. We must follow the sequencing, the priorities of the provincial plan, and then apply that locally. There will be a need to kind of understand the sequencing within those broad guidelines. So if we talk about healthcare workers, which healthcare workers? If we talk about Indigenous peoples, urban and First Nations, how do we tease out the risks in those groups? We do know that the long-term care home residents and then staff and essential caregivers are priority number one of the priorities. And so fingers crossed, I'm very hopeful that we will have vaccine as early as this week, fingers crossed, so that we can get vaccine in the arms of residents of long-term care homes and high-risk retirement homes. We're aiming for the 5th of February. That's as precise as I can be on that one, but we are very well ready to do that with our long-term care home partners, community paramedicine, the hospital here in Sudbury. So working together with that. Beyond that, it gets a bit more murky. We do know that the Pfizer vaccine, that there was not just a slowdown, but a stop. In fact, this week we were expecting vaccine in Canada from Pfizer, and that has been stopped. But we are ready and gearing up for that. I think, Katrina, what it will be is that right now we're having really a slow dripping tap of vaccine, sometimes a stop of that tap in our province, but that suddenly that will open wide. And so we need to be ready for that. So with Public Health Sudbury Districts and across the north, certainly I would say, we've all had a requirement in public health to lead this programming, to get the planning ready and to develop our own playbooks. And so for Public Health Sudbury Districts, that has meant that we've developed a structure, that we have the command table for that, but we also have established geographic-based implementation committees. So that's a mouthful, but what I mean by that is that although public health has done vaccine for years and years, and we know what we're doing, et cetera, this is a massive and complicated program that is going to require a lot of different players. And so the geographic implementation committees are the people who know what's happening in their own backyards, in their own regions. Who are the healthcare workers? What do the facilities look like? How do we actually organize the vaccine getting into arms, on the ground in the various parts of our geography? It doesn't look the same everywhere at City of Greater Sudbury as it might in places in Manitoulin Island. So making sure we take that into account. So all of this is being planned right now so that as soon as the vaccine is here, we're good and that we're ready to go. I think the other thing you asked about, is when will life get back to normal? What do we know, et cetera? I mean, I know the federal government, provincial government have talked about this summer or August or September, by which we would have hopefully 75% of the population covered. And so we are absolutely, aiming for that. It all depends on the vaccine supply, no doubt about that. But we're very excited about it, and we absolutely want to focus on that. The only thing I would say is at the same time, we have to make sure that we maintain our public health measures. And so for public health, that means that at the same time that we are working hard to get ready to immunize people, we also have to make sure that we are following up on cases and on contacts. So it's a pretty heavy demand, but one that we are absolutely committed to and really dedicating the vast majority of our resources to. So if you haven't heard much about anything else from public health lately, that's why.
That's a good point. That actually leads very well into the next two points that I have here. So one of our commenters said, just a shout out to all of the frontline healthcare workers and the long-term care home workers with everything that they have been doing. I 100% agree. You know, we've talked about it in the past, and there was a lot of celebration for everything that they were doing. But I mean, this just goes out to all healthcare workers at the moment, everyone who has stepped up, of course, including all of the people who have come out of retirement all over the world to help. It's really amazing to see so many people caring. And on that note, you know, we have another question about how you are and how the health unit here is holding up, and how many hours a week you are working and how much contact tracing is happening and what is going on. So, you know, I think with everything happening in the community, we're familiar that public health is probably extremely busy. Is there anything on your end that you want to say to that at all?
You know, thank you for that opportunity and for the question and for the comment. We have a small but mighty team, and we are absolutely punching, you know, well above our weight, if you will. We have about 250 employees who are probably doing the job of, you know, 500 employees right now in terms of the hours that they're working and the dedication. And it's not only the hours. I really want to comment on the attitude that I'm seeing. We have staff going above and beyond. So individuals who have become infected through no fault of their own with COVID-19, who are now struggling with social and economic issues. How do we help them into the night as we're learning of their challenges? So really going above and beyond to identify and follow up. Our hours, I can say personally, it's certainly a 7-day-a-week job, and the hours are long, there's no doubt. But I am surrounded by the most amazing team that anyone could really hope for in terms of our public health leaders and all of our staff at Public Health Sudbury Districts. So we're here for you, we're here for our community, and to absolutely do our best. And if I could, just building on the kindness and the patience, I think that's the other thing that we are all in this together. We have different challenges at different points in time. If we are not meeting expectations on certain things, you know, patience with us. We are absolutely doing our best and working very hard behind the scenes and in front of the scenes to make sure that we are protecting everyone in our service area.
Mm-hmm. I think that's a really good point in terms of, you know, not only are you now dealing with this pandemic, you are still dealing with all of the other public health issues that we were experiencing before. Just like our hospitals and our healthcare system, you know, we still have people who are, you know, experiencing other illnesses or other things that are happening, needing emergency surgeries. And this, of course, is taking a toll on everybody that works in our healthcare system. So I think it's a good point to remember to just have patience, and that everyone is doing the best that they can with what they have at the moment. And I think that's just a really good message to drive home for sure. We all need to have a little bit of humanity right now with everything that's happening. So I very much appreciate those comments from you as well. Okay. We've got so many school questions. You can really tell what's going on in our community right now with a lot of these school questions. There's a really interesting one here about rapid testing in schools. Is that going to be implemented in Sudbury is the question. So is that a thing that we might see happen? And again, do you know if that's even a thing that we might see happen?
Right. So maybe. I don't know the answer to that, but what I do know is that the province has said that the surveillance testing or more testing is part of the safer, you know, back to school plan. So I suspect that there will be a provincial rollout of that, and that school boards will either be volunteered or they will volunteer to participate in that. I think that it really is at the board decision about what to do, but certainly making sure that there's public health input and public health support. One of the benefits of the rapid testing is that we get an overall sense of what's circulating in our community, and that's really helpful. Of course, currently with those rapid tests, we have to do confirmatory tests afterwards to really make sure that it is a positive case. So it'll give us a sense, but not certainty, and is another measure that the province is putting forward to help to understand and keep kids safe at school, which, as I mentioned, I am 100% behind.
Okay. And this is another very interesting question. Again, I'm not sure if you would know, but we have a viewer asking, has Sick Kids done any research into the difference between virtual school and in-person school? So there was a comment, again, along with this, saying that, once the kids got into a routine at home, they absolutely loved it. And I'm sure that's the case for some and maybe not for all. But is there research happening with this difference in what can be called like kind of a back and forth sort of yo-yo effect of going to school and then coming home and then going back and then maybe having to come home again?
So I don't know about the research that is being done, but if it's not, I'd suggest it's a very important area to research. And I think one of the things we're hearing is about stability. So whether the school is in person or virtual, the stability of that versus going back and forth is probably very good for our kids. I would also note that we're certainly aware that, and as you mentioned, not every family is able to manage the same as every other family. And so being virtual, where you're in a household that has difficult access to Wi-Fi or difficult access to computers and families that are stressed is not a good recipe for successful learning. So we all have different needs. And my hope is that our education system is able to respond to those needs and to different families' concerns as we also work to stay COVID safe. It's a difficult balancing act. I absolutely understand that.
For sure. Okay, I believe we have time for maybe one or two more. So one that just came in, again, we're looking at the school spread that we're seeing right now. The question is if you could address spread in busing or what's happening with the buses. So I'm aware that, this is kind of encompassing what's happening at schools, and buses, of course, are crossing over. Is there anything that we can do with what is happening? What I guess I'll leave that to you. What is the main goal with what's happening with our schools right now and the outbreaks, and what can we do to kind of protect these students that are on these buses?
Mm-hmm. And so my job is complicated, but the head of the school bus consortium, and I'm sure it's the same across the north, is even more complicated in terms of really figuring out the best way to get our kids to school back and forth across our vast geography. So very complicated. And I know that there is really good work that's being done to try to limit the exchanges on buses to be as effective as possible with that. So we know that there are the requirements on busing with regards to considerations for distancing, considerations for where you're sitting, and considerations for masking. Very difficult to enforce. I understand that. But for people to be aware that where there is a confirmed case of COVID-19 in a student, and that student was on a bus, that entire bus is dismissed. Doesn't matter what school that bus was taking you to, if it was the same school as the individual case or not. And so that is a way that we further protect from potential exposures within buses, because we know that it's very difficult in a bus full of young people to have perfection as it relates to COVID safety measures, and so we need to err on the side of caution. So this causes a fair bit of disruption for families, suddenly learning that their child now has to be at home for the full 14 days of isolation. But that is one of the measures that we take to prevent the spread of COVID-19 and protect our kids.
Of course. Yeah, it's I guess a tricky situation, I'm sure, especially, we've talked about parents not being able to, maybe bring their kids to school or keep their kids at home. And so, of course, there's a lot that goes into the thought and the planning of all of this, I'm sure. Okay, we've got just a little bit of time left. So I want to ask you, of course, we've talked about guidelines, we've talked about what's happening in the community. There's so much going on. What is the best way for people to stay informed, make sure that they know what's happening, make sure that they can stay safe in our community? Where do they go? What do they do? What should they be listening to? Where do we get the best information possible?
Well, of course, you know what I'll say at our website at Public Health Sudbury Districts, so phsd.ca. We point to a lot of other sources. So if you visit our site, you will find valid sources of information, and then also what we hope to be clear summaries of that information, and that's relevant to our local communities and to your local situations. So I would absolutely say to point to our site to come and see what's there, information on vaccine, on back to school, on outbreaks, on COVID safety measures, on all kinds of things. So certainly recommending that be one. Of course, the Ministry of Health, Public Health Ontario, the federal government, Science North, but really credible sites to make sure that you stay informed. There is so much information out there. Do cross-reference, fact check what it is that you're reading and what you're understanding.
Thank you for that. I cannot agree more. Of course, we are in the middle of this virus of misinformation project, as I mentioned earlier, and we are seeing a lot of misinformation. Science North has been coming across a lot of misinformation, and we are also doing our best to address whatever we can to our visitors, both in the Science Centre and, of course, outside of the Science Centre now that we are not in there just yet. Fingers crossed that we'll be able to welcome everyone back soon. So that's fantastic advice. And like I said, I will echo that. Please check your resources, check where you are getting this information. It is super important to stick to reliable, valid sources. And of course, if you are questioning anything, Science North has a group of wonderful people who work on our social, and so does the health unit. Please ask your questions and get the right information, so you can best protect yourself as well as everybody in the community. And that is all the time we have. So quick, but a lot of information. So thank you to everybody who was with us. Thank you, Dr. Sutcliffe, for joining us. We know how extremely busy you are, so we're so thankful to be able to ask you all of these questions. And to everyone out there, I thank you for sending your questions to us. Keep sending them. We will always do our best to answer what we can. We will find the information for you. Please stay safe. And of course, follow us on social media for more information about our Virus of Misinformation project. And of course, follow the health unit at Public Health Sudbury Districts on all platforms to follow along with what's happening in our community. And Dr. Sutcliffe, I need to mention there are so many thank yous in the comments. So we definitely greatly appreciate your time today, and we know it's not easy to take this much time. So thank you again for joining us, and we hope everyone has a great day. So thank you, everyone.
Thank you very much. We've got this.
Yeah, we do.
Okay. Thank you.